Did you know that your skin, the largest organ in your body, can sometimes whisper secrets about your health without you even realizing it? It's true. We often think of our skin as just a covering, maybe something that shows our age with a few wrinkles or sunspots. But it's also a remarkable indicator, a sort of window into what's happening beneath the surface. Sometimes, a seemingly innocent little change you see on your skin, something you might just brush off as nothing, could actually be a quiet signal, a potential sign that needs your attention. It's a reality that can feel a little unsettling, isn't it? The thought that something so small could mean something significant. But the truth is, knowing what to look for empowers you. It takes away some of that uncertainty and gives you the ability to act. In this video, we're going to gently explore some of these silent signs, the subtle changes on your skin that are important not to ignore. We'll talk about what they might look like and, more importantly, what to do if you spot them. It's not about causing worry, but about giving you the knowledge to stay proactive about your health. Stick with me until the very end, because I'm going to share something that might truly surprise you about how easy it is to keep an eye on things. Let's start by talking about moles and spots, because these are probably the most common things we notice on our skin as we get older. We all have them, don't we? Some we've had our whole lives. Others seem to pop up out of nowhere, most of the time. These little marks are completely harmless. They're just little clusters of pigment cells. But sometimes, just sometimes, a mole or a new spot can change in a way that signals something more serious might be going on. Something like melanoma, which is a type of skin cancer that starts in the cells that make pigment. Now, the good news is that melanoma, when caught early, is very treatable. The key, though, is catching it early. And that's where paying attention to your skin comes in. So, what exactly should you be looking for? Dermatologists often use a simple guide called the ABCDEs of melanoma. It's a really helpful way to remember the important things to check. The A stands for asymmetry. Imagine drawing a line through the middle of a mole. If one half doesn't match the other half, that's asymmetry. And it's something to be cautious about. Most harmless moles are symmetrical. If you cut them in half, they'd be pretty much mirror images. But a suspicious mole might be lopsided or uneven. It's a subtle difference sometimes, but it's the first clue in the ABCDEs. Next is the B, which stands for border. Look at the edges of the mole. Are they smooth and even? Or are they ragged, notched, blurred, or irregular? Harmless moles usually have nice, defined borders. Melanomas often have irregular or poorly defined edges. Think of it like the coastline on a map. Is it a smooth, gentle curve? Or is it jagged and all over the place? Irregular borders are a red flag. Then we have C for color. Is the mole one single shade of brown? Or does it have different colors or shades within it? Suspicious moles might have variations in color, like shades of brown, black, tan, white, red, or even blue. A mole that changes color, or has multiple colors within it, is definitely worth getting checked out. Most benign moles are just one consistent color all the way across. The D is for diameter. This refers to the size of the mole. While melanomas can be small, they are often larger than 1/4 of an inch across. That's about the size of a pencil eraser when they are diagnosed. If you have a mole that's larger than that, or one that seems to be growing larger, it's something to keep an eye on and probably get looked at. Size isn't the only factor, but a larger size, especially combined with other factors, increases suspicion. And finally, the E is for evolving. This might be the most important sign of all. Is the mole changing over time? Is it getting bigger, changing shape, changing color, or starting to itch or bleed? Any change in a mole or a new growth is a reason to see a doctor. Harmless moles tend to stay the same over time. A mole that is evolving, meaning it's changing in any way, is the most concerning sign. It's the difference between a mole that's been there forever and looks the same, and one that is actively doing something different. So, remembering asymmetry, border, color, diameter, and evolving is a fantastic tool for doing your own regular skin checks. And honestly, checking your skin regularly is one of the most powerful things you can do. How often? Maybe once a month. Pick a day, perhaps the first day of the month, and make it a routine. You need good lighting and maybe a full-length mirror and a handheld mirror to see hard-to-reach places like your back, scalp, and the soles of your feet. Ask a partner or family member to help you check areas you can't see easily. Take your time and be thorough. Look everywhere, between your toes, on your palms, under your fingernails, on your scalp, ears, neck, and back. Look for anything new or changing. If you have a lot of moles, it can be helpful to take pictures of them from time to time, perhaps every few months, so you can compare and see if any are changing. This simple act of looking can make all the difference in catching something early. But skin changes aren't just about moles. There are other types of silent signs that aren't dark spots at all. Sometimes, it's a patch of skin that looks or feels different. This brings us to another important category of skin cancers. The most common ones, actually, known as non-melanoma skin cancers. These include basal cell carcinoma and squamous cell carcinoma. While they are generally less dangerous than melanoma, especially if caught early, they can still cause significant damage to surrounding tissue if left untreated, and in rare cases, can spread. One type of non-melanoma skin cancer, specifically basal cell carcinoma, often appears as a new growth or sore that doesn't heal. This is a crucial sign that is often overlooked. It might look like a pearly or waxy bump, almost translucent, sometimes with visible blood vessels, or it might present as a flat, flesh-colored or brown scar-like patch. The key characteristic here is persistence and often a lack of healing. Have you ever had a little bump or sore that just doesn't seem to go away? Maybe it scabs over, but then the scab falls off, and it just doesn't heal completely. Or maybe it bleeds easily with minor injury. That non-healing aspect is a major red flag for basal cell carcinoma. It's like your skin is trying to fix itself, but it can't because something abnormal is preventing it. These often appear on sun-exposed areas like the face, ears, neck, and hands, but they can show up anywhere. Then there's squamous cell carcinoma. This one often presents as a firm, red nodule, or a flat, scaly, crusty patch. It might look like a persistent sore that doesn't heal, or a patch of rough, dry skin that keeps coming back. Think of a rough, scaly patch that you might just assume is dry skin or eczema, but it doesn't respond to moisturizer. It might be tender or painful to the touch, or it might itch or bleed. Squamous cell carcinomas also commonly appear on sun-exposed skin, the face, lips, ears, neck, hands, arms, and legs, but they can also develop in scars or chronic sores elsewhere on the body. A key difference from benign rough patches is that these tend to be persistent and often grow larger over time if not treated, sometimes before a squamous cell carcinoma develops. You might notice precancerous lesions called actinic keratoses, or AKs. These are small, rough, scaly spots that are usually red, brown, or skin-colored. They feel like sandpaper when you touch them. AKs are caused by years of sun exposure and are most common on areas like the face, scalp, ears, hands, and arms. Think of them as early warning signs. Not all AKs turn into squamous cell carcinoma, but they have that potential. And having many AKs increases your risk of developing skin cancer. Your doctor can treat AKs to prevent them from progressing. So, those persistent rough patches that just don't seem to go away, don't just ignore them as old age spots or dry skin. Get them checked. Another type of silent sign can be a change in existing spots that you might already have, like freckles or age spots. While freckles are generally harmless, and age spots, also called liver spots, are also usually benign signs of sun exposure, it's important to monitor them too. If an existing age spot starts to change in size, shape, color, or texture, or if it becomes itchy or starts to bleed, that warrants a checkup. While age spots themselves don't turn into cancer, it's possible for a skin cancer, like melanoma, to develop within or very close to an existing age spot, which can make it harder to spot initially. That's why that overall view of your skin and noticing any change is so critical. Let's also consider changes in texture. Beyond the rough, scaly patches of squamous cell carcinoma, or AKs. Sometimes a patch of skin might just feel different, thicker, firmer, or even numb or tingling in a way that doesn't make sense. While less common as a primary sign of skin cancer compared to changes in moles or persistent sores, unusual changes in skin sensation or texture, especially if persistent or progressive, should also be brought to the attention of a healthcare professional. For example, certain less common types of skin cancers or conditions related to skin cancer can sometimes cause changes in sensation. It's also worth looking at areas that aren't typically exposed to the sun. While sun exposure is the biggest risk factor for most skin cancers, they can still occur on areas that rarely see the light of day, like between toes, on the soles of feet, in the groin area, or under fingernails or toenails. Melanoma under a fingernail or toenail, called subungual melanoma, can appear as a new dark streak under the nail that isn't caused by an injury. It often starts as a light brown or black line and can widen over time, potentially affecting the nail itself, causing it to lift or split. This is another one of those silent signs that people might dismiss as a bruise or fungal infection, but it definitely needs professional evaluation. So, you see, it's not just about the classic image of a changing mole. Silent signs can also be a sore that won't heal, a persistent scaly patch, or even a strange mark under a nail. The key thread running through all of this is change and persistence. Is something new appearing? Is something you already have changing? Is something not healing as it should? These are the fundamental questions to ask yourself when you're looking at your skin. It can feel a little daunting to think about all these possibilities, but please remember that the vast majority of bumps, spots, and patches on our skin are benign, meaning they are not cancerous. However, the only way to know for sure is to get them checked by a doctor. That's the empowering part. You don't have to diagnose yourself, and you shouldn't try to. Your job is to be aware of your skin, notice changes, and then let a professional take a look. Knowing what to look for is the first step. And hopefully, understanding these potential silent signs helps you feel more prepared. But what's the next crucial step if you do notice something? It's simple, but it's the most important piece of advice I can give you. Make an appointment to see your doctor, ideally a dermatologist. Don't delay it. It's so easy to fall into the trap of thinking, oh, it's probably nothing, or I'll get to it later. But with skin changes that could potentially be cancer, time can make a real difference. Early detection truly saves lives and leads to simpler treatments. If you notice a mole that fits any of the ABCDE criteria, a sore that doesn't heal after a few weeks, a new or changing growth, or any other persistent or concerning change on your skin, call your doctor. When you go to the appointment, be prepared to tell your doctor when you first noticed the change, if it's changed recently, if it itches or bleeds, and if you have any family history of skin cancer. Don't feel like you're being a bother. Doctors want you to bring these things to their attention. It's part of their job to help you stay healthy. And checking out suspicious skin changes is a routine part of that. They can examine the spot thoroughly, maybe using a special magnifying tool called a dermatoscope. And if they are concerned, they can perform a simple procedure called a biopsy. A biopsy usually just involves removing a small piece of the suspicious area, or sometimes the entire spot, which is then sent to a lab to be looked at under a microscope. This is the only way to definitively know if the cells are cancerous or not. While waiting for results can be nerve-wracking, it's so much better to know for sure. And here's something that might surprise you. Something I wanted to share at the end: you already possess one of the most effective tools for early detection: your own 2 eyes and a mirror. That regular skin self-examination we talked about. It is incredibly effective. Studies and anecdotal evidence show that people who regularly check their own skin, or have a partner help them, are more likely to spot melanomas at an earlier stage when they are easier to treat. You know your skin better than anyone else. You know what's normal for you. Taking just a few minutes each month to really look at your skin from head to toe is a powerful act of self-care. It doesn't require fancy equipment or a doctor's visit every time. It just requires your attention and commitment. Remember, finding something suspicious does not automatically mean it's cancer. Most skin changes are benign, but being proactive means you can catch the few that aren't early. Think of your monthly skin check not as looking for something bad, but as a routine health habit, like brushing your teeth or exercising. It's just another way you take care of yourself, empowering you to live your healthiest life. So, please, make that habit of looking at your skin a priority. Get familiar with what's normal for you, and don't hesitate to seek professional advice if you see anything that concerns you. Your skin tells a story. Learn to listen to it. Don't keep this important information to yourself. Share it with friends and family, because knowing these silent signs could make a difference for them too. If you found this helpful, please give this video a like so more people can see it, and subscribe to the channel for more simple, practical tips on staying healthy and living your best life at every age. We're in this together, supporting each other on our health journeys. Take care of yourself. Pay attention to those whispers your skin might be sending. And remember, being informed is being empowered.